Hey guys, Jimmy Yin here, the Acupuncture Neurology Specialist, and today's Wednesday. Wednesday, we're going to go over Why Wednesday. So this is a continuation of my discussion of what goes on during an initial exam in an acupuncture clinic, more specifically in our clinic at Achieve Integrative Health in Cedar Park, Texas. So one of the gold standards of how we diagnose a patient and to figure out what's the root cause. So the root cause that we're looking for is an organ dysfunction, because we believe in Chinese medicine, if your organs aren't functioning up to par, if they're not functioning at optimal levels, that's where we get all of these symptoms that we start experiencing it, right? And the Western medicine diagnosis that you are labeled with is not always the root cause. Majority of the time, it's not the root cause. For example, neuropathy. Neuropathy is not a cause. It just means you have nerve damage. Your nerves are dying. It does not tell us what's causing it, right? So in our clinic at Achieve Integrative Health, we use something called pulse diagnosis. Now, if you've gone to other acupuncture clinics, everybody uses pulse diagnosis. We use our specific pulse diagnosis called functional pulse diagnosis, which is different from other pulse diagnosis, especially the ones like I learned in school, okay? So what is the pulse diagnosis? Well, different sections, 3,000 years ago, Chinese people figured out different sections of your radial pulse correspond to different organs in your body. How they figured that out, I have no idea. But they discovered it 3,000 years ago, and it's still here. So it must actually make sense. Even though scientifically they can't prove it yet, eventually they will be, okay? So use this information. I'm just gonna go over the right side. So when I'm feeling your pulse, doing my functional pulse diagnosis, different sections, like the first section closest to the thumb, it actually corresponds to your sinuses area, your head area, your lung, and your large intestine. So by feeling the blood circulation to this specific section of your pulse, it's going to tell me do you have allergies? Do you have inflammation in your sinuses? Do you have a headache? Maybe you have a respiratory problem. You have cough, you have lungs, you have bronchitis or something, inflammation, where you have a lot of mucus. It can also tell me if you're constipated, where you have diarrhea, just by feeling this pulse right here, right? The second section corresponds to your spleen, stomach, and digestion. Okay, that tells me how your digestive system is doing. That's when I tell people, oh man, your digestion is sluggish. What that means is there's not a lot of blood going to your digestive tract. And it also could mean that your stomach doesn't have enough stomach acid, and therefore it's not breaking down the food that you are currently eating. Now, in between these two sections, there's a little section, and that corresponds to your thyroid. So when I feel that specific section and I feel some inflammation within that area, that tells me that you have a thyroid problem. And that's usually what I will, if the patient has not already gotten thyroid testing, I would highly recommend they get a thyroid panel to confirm what I feel in the pulse. And 100% of the time, there's something wrong in their thyroid. That area also corresponds to the throat. So sometimes maybe you have acid reflux and it's burning your esophagus. That area will also show up as being inflamed, okay? And so the third area corresponds to your bladder and your urinary system, your urinary tract, right? So for women, if you have a UTI, this area of your pulse will actually be inflamed, okay? And so it also corresponds to your neck and shoulders. So I'm feeling for different shapes of the pulse, and it can tell me, oh, is the neck and shoulder pain that you have, is it in your muscles or is it in your spine? The cause is in your spine. So that's the beauty of our functional pulse diagnosis. We can get to the root cause because it's the organs that control the healing and the repairing of your body. If your organs are not functioning at optimal levels, you're not going to heal. Doesn't matter what medication you put in your mouth, doesn't matter what supplement you put in your mouth, doesn't matter what food you put in your mouth, right? You have to figure out what's the root cause, which organs are dysfunctioning, right? So I'm just going over this side. This is the right side. If you're interested, I can go over the left side, but if you're not, then I'll just move on to the next topic. So this is what we do at Achieve Integrative Health. in our initial exam. This is why we spend so much time. We block off a whole hour just for you, and so we can find the root cause of what's going on. Because if you don't find the root cause, which is an organ dysfunction, then you're never going to fix the problem. It's always going to keep on coming back, okay? So hopefully this is beneficial, and I'm going to continue this series of letting everybody know what's going on, what's going on during the initial exam at Achieve Integrative Health. What we do, I will say a caveat to this. What we do at Achieve Integrative Health in our initial exam is not common for acupuncture clinics. That's why I'm going step by step as what we're doing. So this is the main diagnostic tool that we use. I think Monday I talked about we use infrared thermography. We use infrared thermography to also confirm what we feel in the pulse. So we combine those two technologies. This is a 3,000-year-old technology. Infrared technology is pretty recent. It's only about 100 years. And so we combine two of these technologies together, we can get a more accurate assessment as to what's going on in your body and what's preventing your body from healing itself, okay? If you like this post, comment below, share this post to someone who's suffering right now, and they may need some help. Pay it forward to your friend. All right, guys, Jimmy Yen from Achieve Integrative Health, and as always, remember, everything in life is achievable, but it's up to you to make it happen.